back to Ethics for the Modern Massage Therapist. I'm Robin Anderson here again with Amelia Mitchell, and we're almost about halfway through the course here, and I wanted to sort of touch base on a couple of terms that maybe are not so common in ethics. I mean, we learn in our initial massage therapy education the terms like transference and countertransference, but we've never really touched upon things like value concerns. So we want to sort of touch upon these other ethical concepts that, you know, maybe are a little bit more heavier in nature, if you want to call it, that are definitely more prevalent as massage therapists that we tend to experience, as well as other allied health professionals too. I mean, really, we draw a lot of parallels with other professions like nursing or occupational therapy or respiratory therapy. You know, we do the same type of work. We're working with the general public. We're working with the human body and a person. So, you know, that has its ebbs and flows in dealing with that. So let's touch upon some of these terms, Amelia. So sort of let's enlighten our audience here about some of these terminologies.
Absolutely.
So let's start with compassion fatigue and how it leads to burnout.
Absolutely. We've got a good intro into boundaries at this point.
Yeah.
And boundaries that are becoming unhealthy are a really good clue to the risk of compassion fatigue. And compassion fatigue is essentially what happens as we build towards burnout.
Yeah.
And it is generally because we are taking on too much of our clients' stuff. We are not taking enough care of ourselves, and we are getting into this fuzzy space where do I start and where do they stop, and is this my problem or their problem? And frankly, it's something to discuss for massage therapists because we are big-hearted people. We really care about, you know, nobody goes into this profession who doesn't really care about helping other people.
Right.
So when you're getting home after a full day in the treatment room and you're exhausted physically, perfectly reasonable.
Mm-hmm.
If you're exhausted emotionally, if you don't feel like you have the energy to really live your life, those are clues that you may be getting into some fatigue place at this point, and finding the things that you need to do to take care of yourself. And it may be have stronger boundaries, it may be change your schedule, it may be all sorts of things in your life. That's going to be necessary to prevent getting to full burnout.
Yeah. And I think we're going to revisit the whole burnout thing because most of these topics kind of lead to that, such as, here's another one, playing the hero. So what's that?
Playing the hero is, I can fix everybody, I can fix you, I can take care of you, I've got it all, I am the bestest ever. And what happened, how that plays out in the treatment room is feeling like your client who just walked in and unloaded this list of aches and pains and complaints and this and that, feeling like it is instantly your responsibility to take care of all of it, and you know everything and you can just take it all on. The reality is people didn't get that way in a day.
Right.
Our aches and our pains and our this is and that, they've built for years. There is no one perfect modality that is going to fix everything. Massage is great, but it is not the be all and end all of everything.
Right.
And if we get too caught in this, I must fix it all, I can do it all, we lead our clients astray. Because one, we're playing that power differential and we're being an expert in places where we probably are not expert.
Right.
We're getting them to lean into us probably too heavily. And we're burning ourselves out also.
Yeah, and burnout can mean so many different things. I spend time talking to my entry-level students about that and how self-care is so important. But if there's one phrase that I always tend to use, whether it's either one of those scenarios, compassion fatigue or playing the hero, paying attention to your intention just seems to me the thing that is the takeaway here, is that you have a client that presents to you and your goal is to try to help them with that problem, but you might not be able to fix it in a day. And you also can't feel horrible about the fact that they're still in pain or that you couldn't fix it in a day, and then you go home and cry about it later, so it's paying attention to your intention. But I also make the joke to my students that when you're in the room, you need to be in the room, but once you go out of the room, you need to leave it in the room. So not to make light of this topic, but you know how they say what happens in Vegas stays in Vegas? Well, what happens in the massage treatment room should stay in the massage treatment room.
Yep.
And that's one way of developing a healthier boundary without taking on that compassion fatigue and with not taking on that guilt that I didn't fix everything in that first session. So it's not just body mechanics. It's not just the running the business. It's also that interaction with a client that can really take a toll on it. And yes, I'm the person that when I go home, I don't answer my phone. I don't go on email. When I am taking care of me, nothing else happens. So, and it's important.
Good plan.
Yeah, absolutely. So, all right. So we always have to focus on burnout, I think, because with the type of profession that we're in, that is an ebb and flow concept. So with the things that we just discussed. Now let's move on to value conflicts. So what does that mean exactly? Tough question.
Value conflicts are in this sort of circumstance, we're bumping into having different points of view than our clients.
Mm-hmm. Okay.
And when we land there, what are we going to do? If a client feels very strongly about something on one side of a conversation and you feel very, very strongly about another, what are you going to do about that? You're going to back off and remember that it's your client session and you just need to shush.
Right.
And if there's a lot of conversation going on, this is a place, and you named a few boundaries you have around topics you don't discuss in session. This is a place to say, yeah, I don't do politics in the treatment room.
Right.
Which is, always a topic that gets people very polarized within different value settings. It's also a place where you're listening to a client and you're finding that you're just disagreeing with them and you think they're doing it wrong.
Mm-hmm.
And why would you choose all of those modalities when you could be doing this? Well, the reality is we are not the experts in our client's life.
Mm-hmm.
They are the experts in their life. So even if I'm getting triggered about that, again, I need to come back and look at why I'm getting triggered. It isn't necessarily my place to say anything to the client.
Mm-hmm.
There can be situations where you and a client are just oil and water. It is just not a good thing. And there may be a place where it is time to say to somebody, I'm really not the best therapist for you. I don't feel like I can really support you. I would like to, suggest some other alternatives to you. If there is such a deep conflict that being in the treatment room with this person is really simply triggering you.
Yeah.
And not a lot, but I have had a couple of clients over the years who seemed to take a bit of pleasure in pushing my buttons because they knew I felt differently than they did. They knew enough about me to know that I felt differently.
Right.
And those were not long-term client relationships.
Right.
Because that's not healthy for me. That's a game we don't need to play in the treatment room.
Right. And it just kind of goes back to what we were saying before about, topics of discussion that you just don't have with clients. If they know that much about you, then you are putting yourself at risk for potentially having that value conflict.
Mm-hmm.
So, and I agree, I've had those scenarios too. One of the things that I always try to take as a view as a practitioner is that my clients come to me as the professional. They're seeking treatment, they're seeking pain relief, or whatever the case may be. But I may not have the right tools to fix the problem that they have, but I'm not going to let someone tell me how to do my job. So I can say that, well, my expertise may not be what is suitable for you, but I don't even see that as a value conflict. I just see that as just being unprofessional, because you're coming to me as somebody who has these skills, but maybe the skill set isn't quite a good match. And, you deal with it in the way that you just say, I may not be the therapist for you, but I'd like to refer you to somebody else who might be a better fit for you. But I have had those same clients too that have had the complete polar opposite viewpoint of me. And yeah, you really have to, again, the focus is paying attention to your intention. So it's kind of like the cartoon character Charlie Brown in the teacher's room where you hear wah, 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 wah. That's kind of what I do. If I get a client that's doing that, I just tune them out and focus on what my job is, and my job is to take care of their musculature so that they have come here for the session that they've paid for, and that's what I'm going to give them. So, and nothing more. And nothing more. And then making a mental note of, oh my gosh, this client's going to push my buttons again. How am I going to handle this? And am I comfortable with that? So, but you can't necessarily discharge a client without cause.
No.
So, and that's where I feel like a lot of people have issues when it comes to that.
Yes.
So you want to talk about that a little bit?
I think that's a place where, hard conversations again.
Yes, hard conversations.
You cannot just discharge a client. However, you can have a client conversation about what their goals are, and if you are actually meeting their goals, and if perhaps there are other professionals who could be better able to meet their goals.
Right.
And that's not necessarily fun. However, from a long-term point of view, that's a much more professional way to respond to things than to just fire a client without cause, which is absolutely unprofessional and not okay, or to keep someone on just because, oh my God, I've got to keep my clients. Nobody's happy, and your client is not getting the best work at that point.
Right. So I'm just going to touch upon this briefly because I think sort of this topic is pretty obvious, which is sexually inappropriate behavior. For the most part, if it happens and you're not comfortable with it, then it needs to stop. I mean, it pretty much is the way of the world. But I have had many, and I've seen this on discussion boards and discussion forums on social media. I actually feel bad for male clients because they automatically jump to the conclusion of, oh my God, my client has an erection. What am I going to do? And can we just have a discussion about this?
I would be happy to discuss erections.
Yeah, okay.
I'm okay with that.
Yeah.
The body relaxes, and one of the things that can happen is an erection. And that has nothing to do with sexual attraction. It is a physiological response.
Right.
It is just not a problem. And any guy who isn't this pervert that we're all scared of is going to be far more embarrassed than the therapist is.
Or they're asleep.
Or
they don't
they're
even
asleep.
realize
Yes,
that.
that's true.
Right.
Or they're asleep.
Yeah.
So one of my things over the years that I've always done is, because the relaxation and getting to a sleep builds as the session goes on, I try to have men where that might be a risk, I try to have them face down for the end of the session.
Right.
Because if it happens, none of us need to know.
Right.
It's all good.
Right.
It's all good. The problem, people, you're going to know it's a problem because they're squirming, they're asking questions, their arms are
They're
coming.
awake.
They're awake. They're very aware of what's going on in the room.
Right.
They're trying to make eye contact with you. Those are the ones that you need to be more aware of. Those
Right.
are the ones to respond to. And those are the ones where you don't have to second guess.
Right.
Because that's the other thing I hear from people too. Well, I was thinking that might be, but I didn't want to assume. It's like, he's squirming, he's thising, he's thating. You can end the session.
Right. And then, not to put male clients on the spot, but sexually inappropriate behavior can happen with any gender. Right?
Yes, it has. I know of cases of all different directions this has gone. It is not okay. Our treatment rooms are not places for sex, and we should be having absolutely no sexual interactions with any of our clients, period, the end.
Right. Absolutely. So, and then there's a time period that if you do have sexual attraction with a client, I believe it's 6 months is the
I think
general?
that's the general, that you need to just cool it. You need to end your client-therapist relationship.
Right.
And you need to take a time out and let all of that quiet, and then if it is going to be a relationship, it can become one.
Absolutely. So, all right. So I think we've covered a lot of the topics. So I think you ready to dive into some gray areas, Amelia?
Sure.
All right. So next segment, we're going to get into some gray areas and get a little interesting discussion on some of those uncomfortable scenarios that really will challenge your ethical compass. Stay tuned.